In this video, let's talk a little bit about wound care. In my practice, I close almost all of the incisions with Dermabond, which is a glue that goes on the skin. Sometimes the Dermabond is accompanied by a mesh that reinforces it for some of the larger incisions, and sometimes it's just the glue itself. When we do cranial incisions, we're usually putting a little monocryl suture, which is a dissolvable suture on the surface of the skin, but the skin is still sealed off with Dermabond. Dermabond has some really nice properties. It tends to not cause a lot of irritation. It's uncommon to have an allergy to Dermabond. Dermabond seals the wound and it's put on in a sterile environment, so I think it prevents wound infection. Dermabond is also occlusive insofar as it prevents water from getting in. Now, we wouldn't want a patient to soak a new wound underwater for a few weeks until the wound is healed, but taking a shower is okay. And taking a shower, letting the water run right over the wound and then patting it dry is perfectly reasonable, and Dermabond gives us that opportunity. You're not dealing with bandages and things like that. Now, one disadvantage of Dermabond as opposed to staples is that the wounds tend to bleed a little bit more. If there's a little bit of bleeding under the skin, that blood is allowed to escape out the skin more easily than if you've stapled the wound. So we see a little bit more drainage in the first couple of days after surgery with Dermabond. If that happens, I think it's fair to put a little dressing on for a couple of days and some pressure and get it to stop. Otherwise, for wound care in our practice, there's really not a lot that needs to be done. Mostly just keep the wounds clean and dry, alert us with any issues. We don't have a lot of wound issues, but occasionally do. If a wound opens up early for some reason, it's nice to be proactive about management and get something done early on before it becomes worse. So hopefully that's helpful, but most of the incisions, again, are closed with Dermabond. You can shower after surgery. We recommend to not submerge the wound underwater for usually 4 or 6 weeks or until the wound is completely healed on the surface. And if you have any wound issues, please let us know so we can be proactive about dealing with them.